said, I haven't made up my mind. And my job is to do my very best to represent you. Yes. That's what my job is. And I take that job very seriously. I know that there are people here of different political parties, but that's not what this is about right now. This isn't about parties. This is about people. Okay, so if I want to do a good job, you all know. I mean, I'm one of 9 kids. I was raised, if my parents told us anything, I try to teach my children this. If you're going to do something, do it well. That's right. You know, if you're going to do something, do it well. So I'm here to try to do my job as well as I can. And I could do a really good job if you all could spend this time with you're in the different systems, sharing with me and each other what you like about it, your system, or what you don't like about it. And then if you want to make a comment about another system that you're not in, but you're familiar with, fine. You know, and say, I'm not in this system, but these are my opinions about that system. That way we can really, you know, understand a little bit, because we're literally all in a different situation. So that's what I'd love to accomplish, and Paul, if it's okay with you, we can go ahead and just get started. And I think if you all can see this up here, it helps you again. I just want to go over, because I think this is very important. 50% of insurance through their employers, 20% were not covered by anything, 16% are in Medicaid, 13% are in Medicare, 4% have individual insurance, and 1% have veterans. So let's open it up.
Thank you, Senator. We're going to get to the questions in just a minute, but we want to find out a little bit about our audience so you can appreciate. I want you to appreciate the different sides of this question. Raise your hand if you're covered by Medicare. Raise your hand if you're covered by Medicaid. Okay? Raise your hand if you're covered by VA benefits. Raise your hand if you have an employer-sponsored health insurance. Raise your hand if you have to purchase your own individual coverage. Raise your hand if you're uninsured. So you can see the different categories that we're dealing with in this issue. Raise your hand if you're happy with your current health insurance coverage, if you're happy. Raise your hand if you have experienced access, cost, or quality problems with your health insurance. Access, cost, or quality problems. How many of you feel like the cost of your health insurance or copay are increasing faster than your other basic expenses? Let's start then with
what more needs to be said?
That have Medicare or VA benefits. We're going to start those. When those people raise your hand and kind of get the attention of the mic and ask your question or express your opinion. Let's start with that and we'll get to all the other issues first, okay? Okay, go ahead, Dave.
Thank you for taking my question. And you mentioned the 20% uninsured. I'd like to know why illegal aliens, not members of this country, don't belong here, are going to be insured under this. My question is, I have taken the time to look at certain provisions of the bill on the internet. I can quote the section and the page, and it definitely says that they will be insured. They don't even belong here, and I'm paying for it.
Bill you're referring to, as you all know. House bill that came out of the House committee, but there
He ain't
are other
assuming the-
bills. That's why I asked.
He ain't talking about the Senate bill.
There are several bills. I just asked him which one he was referring to. I'm assuming it's the House bill. But it's not, that provision, while it may be in that bill, is not necessarily in every bill. And the issue is this, that is a very good question. I don't believe that I do not believe that people that are not citizens should receive health benefits. Thank you for raising the issue. But one thing I would like for everybody to realize is there's not just one bill, there's several. So that was good, and I hope you got your answer to your question.